What is your opinion on stem cells and PRP and things of that nature in the spine, or in and around the spine?
So that is a pretty hot topic right now because I think everybody recognizes the amount of potential that could come from a regenerative therapy that's effective in the spine, and everybody would want a treatment for that if it's possible. I was just at a conference last week, actually, and I was on a panel with one of the guys that does the most research in stem cells in our pain management space, Dr. Candido, and he's done a lot of studies looking at PRP and stem cells specifically in the spine. And he said it can be very effective. I asked him specifically about this. And it's going to be very effective. The studies he's doing aren't in the United States because we can't really do studies on this type of stuff on patients in the United States. But he's like, we're still kind of tweaking out, doses, frequencies, quantities. There's definitely something there, but we haven't gotten all the way there yet to say, hey, you have this going on. Let's give you, 2 or 3 stem cell injections. That being said, there are a lot of people out there doing that with great results, but that's in terms of what I know of the data right now in regenerative medicine.
I have a colleague of mine, friend of mine that does this type of thing. And I would say that for the most part, my anecdotal experience from patients is that they spend a lot of money on this type of stuff and it doesn't work well. I've noticed that PRP works better with tendinopathies, extremities, wrists, elbows, knees, things like that. I haven't heard too much of that being beneficial in the spine. Have you anecdotally with patients have had anybody that sought this treatment and was like, holy cow, this is a miracle?
Anecdotally, I have not had anybody say, hey, I had a PRP, injection in my spine and it did wonders. In terms of other colleagues in the pain space that have done it, they are saying they get some good results. But I kind of agree with you that, we don't offer stem cells right now. We do offer PRP. We don't offer it to everybody. We do mention it on our website, but I agree with you. The real, and because it's data driven, if we're going to offer this to patients, first of all, it's not covered by insurance, essentially universally. It's not cheap. And so if we're going to offer this, we really want it to be for a condition that we think is going to provide the outcome, have the highest chance of providing the outcome. And so, we don't do a ton of these, but it's going to be the same things you mentioned, like joint injections,
Sure.
shoulders, knees, tendinopathies. That seems to be where there's really good, consistent data on
How do you feel about peptides?
I don't know a ton about them. I've had patients that have been getting them and singing their praises. In fact, I just signed up for a webinar on them. And I think it's coming up in the next week or two. And I want to know more about them because my knowledge on them is not where it should be with what I'm hearing about them. I
did a podcast with the colleague that I was telling you about. Glenn Cochran is his name. He has an office here in Fort Worth called Infinity Functional Performance, I believe is the name of it. And when I had him on the podcast, I kept trying to steer him of what's best for the spine, what's best for rotator cuff tear, what's best for plantar fasciitis. And the approach that he takes is almost every injection he does is a cocktail, right? He's not doing just stem cells for the spine. He's not doing just PRP for a tendinopathy. He's doing this sort of concoction, which I thought was interesting. I haven't heard that type of thing before, which when you're talking about price, you're going to 3x the price that you already thought was expensive when you just take that approach. But it was interesting to hear him talk about that because I was trying to go, what's best for this? What's best for this? Try to get a clear correlation. And he was kind of like, open the floodgates on it.
And it might be hard if there's not a lot of data on that yet. They're probably teasing that out. And I'm sure he's wanting to get an outcome for his patients too. And so maybe he's finding that we can kind of cover all of our bases potentially,
Do you think that there's an ethical way that they can harvest stem cells when this becomes more of a researched and more accepted practice where there's data that supports it?
I do. I think there's a big future in that if it gets figured out kind of the right way, for the right reasons and for the right conditions. We've been injecting. I was an anesthesia resident, and we do the cardiothoracic rotation. Those are always big rotations. They're big cases. Crack the chest open, do bypass, or repair valves and things. And this was 15 years ago now, and we would inject 100 cc's of PRP in all those patients beforehand, just for helping with the healing and the
really
and we didn't think much about it back then. It was just something the surgeon was like, let's get the inject the PRPs and let's get them circulating.
How does PRP help Like when you were doing that, what was the thought process? Was it just to stimulate the healing process?
Yeah, I think part of it was there's going to be a very robust inflammatory response from this huge trauma that's occurring on the body. That's going to require a lot of healing. You crack open the sternum, you spread it out, and now you're stopping the heart in most cases, putting them on a pump that's actually keeping them alive and oxygenating their body. And so once you close everything up, the body's just like in total chaos with inflammation and stress. And so the thought was it's going to help kind of calm that down.
Interesting.